It's 8:21. Cat Neville's going to come your way here in a bit. But first, back in the saddle after a couple of weeks off, Dr. Jeffrey Lowell, professor of surgery and pediatrics at Washington University via Skype. Good morning, Dr. Jeffrey Lowell.
Good morning, McGraw.
There was a story. Did polio show up in Syria? What's going on with that story?
Yeah, this is a very scary and serious situation. So, polio almost eradicated worldwide up until recently, when in some of these horribly war-torn countries, the immunization rate fell from 99% to like 60%. And it doesn't take much for the door to be opened up for these viruses that are very contagious. And so it has started again. And so the incidence of polio in Syria and in some of the neighboring countries has skyrocketed. Something that we in our lifetime have never seen. I doubt you've ever seen anybody who's had polio. From both the musculoskeletal problems to the iron lung, and it is back. And so there is now a very aggressive campaign at the borders, primarily for people who are attempting to flee Syria, to go to Lebanon and other countries that border Syria, to be immunized. So before they can cross the border as a refugee, they're being immunized.
How about in the U.S.? Everybody gets a polio shot, right? I mean, in the U.S., you don't hear of polio anymore in this country.
Correct.
Yeah.
Where it's near 100%. And with that being said, you have the herd immunization strategies, so that if almost everyone is immunized, it can't spread to anyone. But when you go from 99% to 60%, for sure it can spread.
Yeah, interesting stuff. All right. Lots of stories this week about obesity linked to teens. What's going on? What's the latest with that story in the U.S.?
Well, a couple things this week made the news. One is that with the very growing problem with obesity in children, there is now a link to early puberty that has been made. The association has been made. So now the primarily girls who are 8 to 10 years old are now starting puberty and having to deal with this when they're in second grade.
8 years old. It used to be 13, 14 years old, right?
Yep. Now, in some cities, actually, it's started at 6 years old, 6 to 8 years old.
And how does
girls are starting to develop puberty, and it's very difficult because emotionally they're not ready for it. There's lots of other issues related to it, not only at school, at home. So it is, it's not a one-to-one causal relationship, but there's certainly an association with that.
And you think about a 6-year-old. I know that's not every 6-year-old is reaching puberty, but if they are obese, their body thinks they're older than they are, so they sort of turn on those genes, I guess, and all of a sudden they are able to get pregnant. And all of a sudden now, not too long, you're going to have a story where there's a 7-year-old who's pregnant and with a child.
It is certainly not unforeseeable, and we're going in the wrong direction there. And then there was another story also this week about what do we do about this other than the prevention side, the treatment side. And there are now many pediatric surgery centers that are offering obesity surgery to teens and perhaps even younger who are morbidly obese. And we're not talking little obese. We're talking BMIs that averaged 51 in kids who are having one of the 3 or 4 different obesity surgeries to try and prevent this from worsening.
And so doesn't that create a whole other set of problems if a teen is having some type of obesity surgery?
It certainly does, because this is not riskless surgery for sure. I mean, the complication rate is ranges between 10 and 25%, depending on the level of complication you're measuring. And these are potentially major complications. And this is trying to we're balancing two things: the risk of the surgery versus the risk of ongoing obesity that doesn't really have a remedy in terms of heart problems and diabetes and bone problems and back problems and all of the other high blood pressure problems related to obesity in a 12-year-old.
Oh, just some scary stuff. Doctor, when are you leaving us for 6 months? Do we still have you for a couple more weeks?
Yep, we do.
All right.
Yep, end of December.
End of December. All right, good. Dr. Jeffrey Lowell, professor of surgery and pediatrics at Washington University. He's the best, and he joins us every Wednesday. Doctor, thanks for checking in. Be safe, and we'll talk to you next week.
Take care, McGraw.
That is Dr. Jeffrey Lowell, ladies and gentlemen, via Skype. And when I say via Skype, you can tune in to KTRS.com, also STLtoday.com, and watch the morning show live with our 4 HD cameras. Andrew Dowd, the director, and Dr. Jeffrey Lowell via Skype. And for those of you, the bald-headed back, that's John Beaver, ladies and gentlemen. He's a St. Louis Rams fan extraordinaire. He's the one who runs the radio side, and Andrew runs the TV side.